Good afternoon, all. Greetings and greetings and warm welcome from A.S.S. Ayurvedic College, Nashik. This is Dr. Swapnali Pujari welcoming you all for the national webinar on childhood anemia and Ayurvedic approach. We are organizing this webinar on the occasion of Azadi Ka Amrit Mahotsav and Poshan Pakhwada, which aims at liberation of mother and children from malnutrition and anemia. I am happy to announce that we are conducting this webinar for third time in a row. Let us start this webinar by taking blessing of our Lord Dhanvantri. I requested Samruddhi Dhole to start this webinar.
शङ्खं चक्रं जलोकां दधतामृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मान् स्वच्छान् निरिद्यान् शुकपरिविलसत् मौलिमम्भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यम् वन्दे धन्वन्तरितं निखिलगदवन प्रौढदावाग्निनीलम् रागादिरोगान् सततानुशब्दान् अशेषकाय प्रस्तुतान् शेषान् औत्सुक्यमोहारतिनाशवान् योगोर्वैद्याय नमोऽस्तु तस्मै नमोऽस्तु तस्मै नमोऽस्तु तस्मै नमोऽस्तु तस्मै.
Thank you, Samruddhi. Honorable member of our institute have always motivated us in organizing various webinars. I welcome all respected dignitaries of Ayurveda Seva Sangha, President Dr. Ambaras Kulkarni sir, Secretary Dr. Abhay Kulkarni sir, and Principal Dr. Vinay Sonambekar sir, and also welcome today's speaker Dr. Renu Rathod. I also welcome our senior professor from anatomy department, Dr. Naresh Babu Gupta sir, and senior associate professor from Agar Tantra department, Dr. Abhay Patkar sir. I requested Dr. Kritika ma'am to welcome and felicitate our Gupta sir and Patkar sir. I invite Dr. Kritika ma'am for a brief introduction of today's webinar.
Thank you, Swapnali. Good afternoon, one and all. On behalf of Kaumarbhritya Tantra Department, I would like to welcome Dr. Ambalas Kulkarni sir, President Ayurved Seva Sangha, a visionary who always inspires us in various academic activities. I also welcome Honorary Dr. Ashutosh Yadav sir, Vice President Ayurved Seva Sangha, whose innovative ideas and enthusiasm guides us conducting academic activities in a different way. Further, I would like to welcome another dynamic personality, Honorable Dr. Abhay Kulkarni sir, who is the driving force behind each and every program conducted by Ayurved Seva Sangha Nashik. I also welcome Honorable Dr. Abhay Sukhatme sir, Chairman, College Committee and recognized gynecologist in Nashik. I welcome our beloved and newly appointed Principal Dr. Vinay Sonambekar sir, who always supports us, guides us to carry out these kind of curricular activities. I especially like to welcome today's guest speaker, Dr. Renu Rathod Madam, HOD and Professor, Department of Kaumarbhritya Tantra, Mahatma Gandhi Ayurved College and Research Center, Wardha. She is an inspiration for thousands of Ayurvedic students to learn and practice Ayurveda through their lectures. I welcome all my colleague teachers from A.S.S college, from other college from all over Maharashtra and India as well. Lastly, I welcome all audience joined today, UG and PG students, practitioners. I welcome you all. I take this privilege to introduce our parent institute, Ayurved Seva Sangh, which is a public charitable trust serving the society since 1925. With its five main units, including Ayurved Mahavidyalaya, having UG, PG, and PhD courses, Arogya Shahar Runalaya, which is a 100-bedded hospital, Samshodhan Vibhag, a research wing, Ayurved Patrika, a recognized scientific journal being published since 75 years. And last but not the least is Aushadhi Bhavan, a GMP certified manufacturing unit for Ayurvedic medicines. Coming to today's topic, nutrition plays a vital role in maintaining health of the child. If a child falls sick, the whole family gets affected. So the nutrition is utmost important. Considering this aspect, Government of India has launched Poshan Abhiyan, and the aim of Poshan Abhiyan is to reach out the masses to nation's biggest nutritional central annual Jan Andolan. Under this Poshan Abhiyan, the month of September and the last 15 days of March is celebrated as Poshan Maha and Poshan Pakwada. Today we are concluding this Poshan Pakwada with this webinar. Uh, Now I request Swapnali Madam to continue.
I take the golden opportunity to introduce today's guest speaker, Dr. Renu Rathi Madam. She is a qualified BMS in 1995 and MD Kaumarbhritya from NIH Jaipur in 1998. Her present designation is Professor and Head of the Department of Kaumarbhritya Tantra, Mahatma Gandhi Ayurvedic College and Hospital Research Center, Wardha. She represented guest speaker in 30 in national and international conference and chairperson in 17 national and international events. Also awarded as a National Best Teacher Award of ATI in 2020 and 2021. Best slogan in National Slogan and Poem Competition on Nutrition by the Ministry of Ayush. She worked as a research person for 4 times in Ayush CME, PG guide since 2016 and PhD supervisor since 2017. Ma'am's book on MD Kaumarbhritya on practical aspect is in process. I request to Dr. Renu Rathi ma'am to continue start our guest lecture on childhood anemia and Ayurvedic approach.
Thank you. At the outset, am I loud and clear? Am I audible? Hello?
Yes, ma'am. Yes, audible, ma'am.
Yeah. At the outset, I would like to especially thanks to organizer, respected Dr. Ambadas Kulkarni, Abhay Kulkarni, Principal Dr. Vinay Sonambikar sir, Dr. Kirti Kate, Dr. Pujari madam, and all other faculties, PG and UG students. Everyone, good afternoon to everyone. And my topic is childhood anemia and childhood anemia and Ayurveda approach. Yeah. Is it visible? Shall I proceed? Hello? Hello?
हाँ मैम विजिबल है यस विजिबल
Yeah, okay. So we will start with the topic childhood anemia and Pandu, an integrative management approach. These are the learning objectives, definition of anemia and Pandu, its prevalence, then explain an impact on health with clinical features, describe the type-wise Ayurveda approach, emphasis on complications and treatment, augmentation of the prevention at home and hospital care centers, and need of awareness and take-home message. So start with what is anemia. Anemia means nothing but the decrease in red blood cells count. We all know that red blood cells are the ones which carry oxygen to all the tissues in our body. A lower count of RBCs deprives us our oxygen capacity to carry forward, and body cannot undergo respiration and create ATP, that is adenosine triphosphate, thereby depriving cells of energy. As a matter of fact, anemia strikes more than 30% of the world's population and can be seen most commonly in pregnant women and kids. As per WHO, hemoglobin less than 11 in children and pregnant women, while below 13 in men, are considered as anemic. So, talking about prevalence, in developing countries, about 40% of preschool children and 50% of pregnant women are estimated to be anemic. 20% of maternal mortality can be contributed to anemia. So we have to be so strictly careful to the prevention of the anemia. There are so many health consequences of anemia, including low pregnancy outcome, that is IUGR, preterm, impaired cognitive and physical development, increased rate of morbidity, and reduced rate of activities in children. So we have already seen that anemia means it is by definition it is a reduction in RBC mass and HB concentration, which leading to reduced oxygen carrying capacity. Anemia is a condition in which the number of RBCs or their oxygen carrying capacity is insufficient to meet physiological needs, which vary by age, sex, attitude, and smoking or pregnancy status, as per WHO. So, if we see the grossly, we can classify anemia in mainly three categories: microcytic, macrocytic, and normocytic. Depending on etiology, we have to check the cause behind it, and accordingly we have to treat. Due to increased blood loss, maybe due to hemorrhagic, or due to increased production of RBCs, decreased production of RBCs, that is hemolytic, and due to increased destruction. So causes of iron deficiency, mainly we can categorize into four different causes, mainly reduced intake, that is intrinsic factors, which are very required for the erythropoiesis, then decreased iron of absorption, and increased loss, and also increased iron demands, that is pregnancy and lactational period. So these are the mainly four four causes. We can divide it into the different causes, and nidan parivarjan is important in chikitsa. So identification of the specific cause is very essential. You can appreciate in this picture that there are the impact of anemia lies on each and every organ and parts of our body, especially central fainting and fatigue, and maybe leads to cognitive impairment, eye yellowing, that is pallor, we can call it as a pallor, then heart, chest pain or angina or a heart attack because of low blood pressure and high pressure on low blood pressure, and the due to less blood is in there, and that's why the heart is very much affecting. Then spleen enlargement, shortness of breath, lungs are the respiration is the proper function of respiration is affected. Then muscular weakness, fatigue and weakness is mainly there. Then intestinal change, stool color. We can many times we can see the melena also due to the destruction of RBCs, or maybe pale, or maybe due to the, as per the leading cause, we have to check and rule out the specific cause. Again, skin yellowing, it is known as a pallor. You can see here the different color, that is, this is a normal picture where conjunctiva is pinkish and reddish, and here you can appreciate that it is whitish in color, that is called as pandu varna, that is pandu, that's why the color, the disease is name nomenclature is that pandu, that is ketki duli sannibaha, that is a mean, by definition, this is, there is a classification, there is a definition, it is a due to pallor or pandu varna, the disease is named on that varna. So here we can see the clear cut difference between pinkish palm and whitish palm. So if we can see the pale and Pandu Varna palm, then we can directly see that patient or baby is having anemia or Pandu. What are the signs of anemia? We directly see that signs means which are the findings by doctor. Signs of anemia include cyanosis, jaundice, and easy bruising. Then, in addition, anemic patients may experience difficulties with memory and concentration, then fatigue, lightheadedness, sensitivity to temperature. That's why it is called as Agnisada or Angamarda or fatigue like condition. Then, low energy levels, shortness of breath, and pale skin. Symptoms may rapidly increase in the onset, rapid onset anemia, especially in severe cases of anemia. Body cannot adjust with the lack of hemoglobin and may leads to shock and death. The nutritional anemia, which is most common, and in that nutritional anemia, IDA, that is iron deficiency anemia, is the most common. It is caused by lack of iron, protein, and vitamin B12. Other vitamins and minerals are that needed for the formation of hemoglobin, which are whenever there is a deficiency of that intrinsic factors, it is called as nutritional anemia, and mainly IDA is most common among that division. Also, folic acid or B12 deficiency is another main cause for anemia. Ayurveda approach that Pittahar Chikitsa is needed here because mainly if we discuss about the Nidan, we can clearly, it is mentioned in our classics that Pandu is specifically caused due to Pittavardhak Ahar Vihar. That's why Pittahar Chikitsa is mandatory here. And for Pitta, Virechan is the drug of procedure. So, choice of procedure. That's why we would like to here give Mrudu Virechan, especially Mrudu in children because harsh Virechan may leads to dehydration. That's why, as per the severity of Pandu, we have to age and sex. So many factors are there, and then we have to decide the mrudu nature of Virechan. Then Ghritapan, Lohokalpa, Pitta Shamak, and Vatalunumak and Bruhan formulations and dietary modifications, especially, are very much required, which help in iron and B12 absorption as well as augmentation of intrinsic factor and checking with the deficiency. An insufficient intake of iron and B12, folic acid, impairs the bone marrow function, which unable to recycle RBCs. The lack of iron may leads to ulcers in the GI tract, and that's why high percentage of patients with nutritional anemia may have potential gastrointestinal disorder that causes chronic blood loss. For example, worms or maybe IBS or malabsorption syndrome. So, if we talk about normocytic, normo means normal, cytic means cytoplasm. Whenever there is a normal quantity of cytoplasm, it is called a normocytic anemia. If we see occult blood or blood loss is there, so if it is yes, then we have to investigate the source, and if the answer is no, then we have to check for hemolysis whether there is a destruction of hemoglobin, or we have to check with the help of peripheral smear and also by Coombs test. So in anemia, particularly, we have to start the workup with the help of CBC investigation. And in that CBC, there are various categorization like especially hemoglobin, then MCV, MCH, MCSC, total is PS. And all these criteria are mainly going to decide the whether the anemia is having microcytic in nature or normocytic in nature or macrocytic in nature. The term specifically we can take the meaning that micro means it is a microscopic in nature, means the cytoplasm or the structure is very micro in nature, small in nature. Then normocytic means normal in nature, and macrocytic means in big in nature. So, as per the categorization, there are certain conditions in which microcytic anemia is often found. That is iron deficiency, anemia of chronic diseases, thalassemia, hemoglobinopathies, and sideroblastic anemia. In these all conditions, we can get microcytic, where the cells are very much small in nature. And in normocytic condition, anemia of chronic diseases, especially chronic disease. Whenever there is it is a secondary cause of anemia due to that presence of chronic diseases. Then early iron deficiency, hemoglobinopathies, and combined deficiencies. And in macrocytic nature, we can rule out the megaloblastic anemias, liver diseases, or hemoglobinopathies. So we have already talking about CBC, and the CBC contains reticulocyte count also, which is up to 2%. It is normal, and if it is increasing in quantity, that is more than 2%, it is called as increased. And whenever there is a increased by 2%, we can say that anemia is present. Then CBC, that is hemoglobin, is in children aged 6 months to 6 years. If it is less than 11 gram percentage, then we can say that baby is suffering with anemia. In 6 to 14 years, if hemoglobin is less than 12, we can say that anemia is there. MCV, particularly that is mean corpuscular volume, is reduced in microcytic anemia, and MCV is raised in macrocytic. Macro means size is big enough. So in macrocytic, MCV is raised, and in MCV, when MCV is reduced, it is called as microcytic anemia. When MCH is reduced in hypochromic anemia. Hypo means less, and chromic means chromatin, that is color pigmentation is there. And if that chromatin means color pigmentation is very faint, then we can see that MCH is less. So MCH is less than 34, then anemia is there. And again, there are so many clues whenever we check PS, that is peripheral smear. There are so many different types of RB, different qualities of. We can able to check the abnormality of the and the cause of pneumonia, cause of anemia. Also, the important test other than CBCR, serum iron, which is directly indicating that whether it is iron deficiency anemia or the anemia due to other reasons. TIBC, that is total iron binding capacity. If it is more, then we can call it as a iron deficiency anemia, because in IDA, the total iron binding capacity gets increased. And serum ferritin, which shows the total storage of iron. So whenever the serum ferritin gets reduced, we can call it as a anemia, especially IDA, because there is a storage is less, which is reflecting the storage. Low ferritin, that is less than 45 microgram DL, and if serum iron is less, then TIBC gets increased, because body want to compensate the situation. That's why TIBC gets increased. In peripheral blood film, we can see that whether the chromatin is hypo or hyper, or microcytic or macrocytic, or whether there is a presence of target cells or typical cells, or anisocytosis or pencil form or helmet cells. There are so many different structures or abnormalities, and as per that abnormality, we can check out the proper cause of anemia. These are the clinical features, especially pallor, may be mild, moderate, or severe in nature. Then children do not thrive well. That is the main complaint of parents is baby's weight is not gaining. That is the main complaint of mother. And that's why we have to rule out the commonest condition of anemia. Patient also having easy fatigability, that is weakness. Patient is not, babies may not be so playful because of fatigue. And pica, whether we have to rule out whether there is a history of pica, means unedible substances, baby is eating or not, like mud or sand or any plaster or like that, which are unedible in nature. We have to rule out the cause as a mrudbhakshan janya pandu. Again, suffering from frequent infections, whether the cause is previous chronic infection or frequent infection, we have to rule out, because these are the secondary in nature. So if we do not remove the cause, basic cause, that is nidan parivarjan, which is the main tool of chikitsa in Ayurveda. So again, splenomegaly, if patient comes with other condition, with other problem like pain in abdomen and the pot belly like feature, and we can found that splenomegaly is there, and then we can see after examination and history, we can rule out the anemia also, because patients mainly come in our OPD with for different reasons, for different complaints. And whenever we go to examine and take history, and we found that there is a pallor, there is a splenomegaly, and there is a very fatigability due to that paleness, we can easily find out the diagnosis that it is a Pandu. Nail becomes thin, brittle, and cholynokia, that is a very nakha, we can say it as a spoon shaped nails are there. The term particularly called as the cholynokia. What is the treatment of IDA? Especially iron therapy is the main therapy in which we have to give the iron calculation as per the dose, that is HB deficit. Whatever hemoglobin is deficit in nature, we have to check as per the age and all, and then multiply into weight in kg and into 4. That is that this by this formula we can derive the total dose, and as per the age we can divide the dose in the per day basis. So children less than 1 year requires 36 mg, children 1 to 5 years of age 72 mg, and children 6 to 12 years required 120 mg. So this is the total dose required at this age, different ages, but we have to give the medicine with different doses. B12, that is 1000 mcg, that is 1 mg, alternate days for 1 month, then once monthly. And we have to taper, and we have to add dairy products, because B12 is rich in milk and dairy products. That's why we have to, as per the artificial supplement, we have to give certain dietary modifications also, and thereby the deficiency can be fill up very easily. Then also we can supply folate 5 mg TDS for 1 month, and then 5 mg once weekly as a maintenance dose. And it's absolutely required that deworming of the patient, because many times, especially we are talking about children, and children are very much prone to get worm infestation. That's why it's very utmost needed to deworming of the patient. Causes of persistent anemia, we have to rule out the cause, because Nidan Parivarjan is important here. And whatever the, whether maybe chronic infection or persistent anemia, we have to rule out the cause, and accordingly the cause, we have to treat the case. Here is the small quiz for you. So please unmute yourself, and you may reply. This is the picture quiz. What is the main cause of hyperpigmentation of knuckles and terminal phalanges? Anyone can unmute and answer. Do you not able to unmute yourself? Okay, the answer is B12. Whenever there is a B12 deficiency, we can get hyperpigmentation of knuckles and terminal phalanges. You can appreciate here the darkness of the knuckles. That is due to B12 deficiency. Whenever we found during examination, we have to give B12, or also increase in the dairy products. What is this? The typical nature of the RBCs. This is sickle cell anemia. And what is this picture? This is the steatocytes, are fragmented red blood cells present on the peripheral smear of sickle cell anemia. And we can get many variety of sizes and shapes also in this PS. What is this? Can anyone answer by unmuting yourself? This is basophilic stippling precipitated by RNA and lead to heavy metal poisoning. Says many times children used to suck the lead pencil, and the lead poisoning may be there, or ETOH abuse or hemolytic anemia. And here we can directly as a petechi-like pigmentation is scattered pigmentation, we can see that is called as a basophilic stippling. What is this? Anyone can guess? These are the Burr cells, that is altered lipid in cell membrane, and that's why due to lipids in the cell membrane or artifact or maybe uremia or renal failure or maybe gastric cancer and transfuse old blood, these Burr cells can found. These are the typical, very typical in nature, and we can see that here very clearly. What is this typical shape? Capsule-like shape, spindle-like shape. These are elliptocytes. These are elliptical in nature, like cylindrical in nature. That's why the term is called as elliptocytes or ovalocytes. Abnormal cytoskeletal proteins and hereditary elliptocytosis. As PGs are here, maybe that's why I'm asking you the for your just refreshment. We will focus on Ayurveda approach only, but I thought it is important because patient generally comes to us with so many investigations and all. That's why we must know these all terminologies. You can see here pencil shaped RBCs, hypochromic microcytic RBCs, that is hypochrome. Chrome is very less, that is pigmentation is very less. Microcytic means small in nature. Then microcytic RBCs, hypochromic RBCs, very clearly it is depicted in this slide. Teardrop cells, that is just like droplet or you can see here like tear-like cells, that is tear-like RBCs. And these are not common. These are not much common, but these are found in PS, and specifically we have to rule out certain conditions like hemoglobinopathies, and so we need to check these conditions. So whenever we talk about newborn or infancy anemia, we must rule out the causes, or like first hemorrhage, then hemolysis and infection. Mainly the clinical features are same, like pallor, fatigue, jaundice, or maybe shock if severe anemia is in nature, and rapid heartbeat is the common complaint, that maybe hemic murmur may be associated, hemic murmur. Then swollen tongue, oral iron supplementation is the main treatment. Here we can see the pallid baby having pallor. Clearly, baby is having the very whitish in nature. The skin is very pale in nature. Lethargicity, baby is not at all playful and very dull in nature, and not able to do his routine activities, and very easily get irritated due to the tej and utsaha, and all these conditions are very much
केबल अनप्लग्ड
aggravated
आहे.
and
बरं ठीक आहे.
easily.
पण नेटवर्क कनेक्शन्स मध्ये वायफायनी काय प्रॉब्लेम आहे?
Is there any problem? Shall I continue? Poor feeding is another reason mother may complain that baby is not taking the sufficient intake. So we must exclude anemia. Now come to the megaloblastic anemia. Megaloblastic anemia caused due to morphological change in the structure of RBCs. Megalo means the big size of RBCs is there, and the main deficiency is oral folic acid and ascorbic acid, because these B12 and folic acids are lacking. That's why we have to supply it, and we have to rule out malabsorption syndrome and congenital defect in absorption, folic acid absorption. Another condition is hemolytic anemia. By definition, anemia resulting from increased RBC destruction in presence of normal or increased erythropoiesis by the bone marrow. So whenever there is a increased erythropoiesis, in spite of there is a erythropoiesis is normal, still the destruction is much high. that's why we have to check whether what are the drugs or what are the conditions or what are the any previous infection like condition. So we have to check whether a patient is having hemolytic anemia or not. So classification, particularly congenital, maybe due to the bone marrow, uh, not bone marrow, but there is a certain conditions like premature destruction due to intrinsic defect in RBCs. Intrinsic defect means the especially some minerals are required for erythropoiesis, and if they are very lacking in nature, then due to their deficiency the destruction going to take place. So that's why we have to supply it artificially and maintain rule out the deficiency state. Then cell membrane defect, that is pyruvate kinase deficiency, G6PD deficiency. Whenever patient is taking aspirin like drugs and the continuous, we can see the recurrent anemia like state. That's why we have to stop these drugs and shift to another one if it at all it is necessary to give. So acquired and congenital, these are the two conditions. And in acquired condition, Rh hemolytic disease we have to rule out by Coombs test, and anemia caused by extra erythropoietic factors. Maybe in first we have consider it as a congenital, in which there is a defect in intrinsic factor, like copper is the intrinsic factor, or certain zinc, copper, or folate or folic acid. These are intrinsic factors which helps in the erythropoiesis. And here in other case, extra erythropoietic factors, in which the example is Rh hemolytic disease, where Coombs test is positive and Rh incompatibility is there. Now coming to the Ayurveda approach. In such conditions where there is a Sahaj Pandu-like condition or congenital condition, then the correction of absorption of intrinsic factor by dietary modifications and Shaman Aushadhis. Shaman Aushadhis having multi-minerals, like we can say that to drink water from copper jug or copper glass, then we can see we can suggest them to eat green veggies and fresh fruits to supply the multiple minerals and vitamins. So correction of absorption of intrinsic factor is the main tool. Then another factor is correction of deficiencies by eating fresh vegetables, fruits, and dietary modifications like copper, the water drinking by copper glass and copper jug. The small amount of copper is added in the water, and we can get it into the. We will not suffer with the deficiency state of intrinsic factor. So correction of deficiencies is mainly responsible whenever we treat anemia. Then to augment erythropoiesis by Rakta Janana Gand. So already in Charak Sutrasthan Adhyay 4, there are different ganas are mentioned, in which we have to certain ganas, means Rakta Janan Gan is described, and we have to give in such condition where there is a lack of erythropoiesis. So to augment the erythropoiesis, we have to give Rakta Janan Gan. To stop destruction of RBCs and hemolysis by giving Tappadi Loha, Abrak Bhasma, Rakta Shodhak Gand, in which there is a this especially Tappadi Loha contains Rajat Bhasma, like metallic contents also. Loha Bhasma is there. So Kasis Bhasma is there. So we have to we can stop the destruction of RBCs, and with the help of Abrak Bhasma, which is very much Dhatu Balavardhak, and also Srodhak. So we can, with the help of Rakta Shodhak Gan also, in such congenital conditions like Sahaj Pandu, we can give such drugs, especially Rakta Shodhak Gan plays a good role in the treatment of Sahaj Pandu. Another tool is Nidan Parivarjan. Rasayan, especially immunomodulation to treat AI, that is anemia, induced inflammation, and chronic infection. Because whenever there is a secondary cause where already the disease is present, that is Nidanarthak Vyadhi, already disease is present, and due to that disease, there is a less appetite and less intake, and that's why the anemia, which leads to anemia. So in certain conditions, rasayan plays important role, especially dhatri and so many herbs and herbo-mineral or metallic preparations are there in our Ayurveda compendia. There are variety of shaman aushadhis are there mentioned in this, and we can give as per the condition of the patient. Now another condition is thalassemia, in which there is a recurrent continuous anemic state is maintained, and we have to give blood transfusion in such condition to maintain the um, proper hemoglobin level, and the irregular fever is there, particular dysmorphic changes are there, and like bossing of skull, depressed nasal bridge, or malocclusion of teeth. Especially with the help of dysmorphic changes nature only, we can diagnose the case that it is a thalassemia, which requires so many times lifelong blood transfusion. So in such condition, the main motto of Ayurveda is to increase the duration of two transfusions. The main treatment is bone marrow transplantation, blood transfusion, and folic acid supplementation. Ayurveda approach is to increase the gap between two transfusion by set treatment principles. And again, for that we can give wheatgrass juice, beetroot, spinach, tomato, pumpkin seeds, jaggery, lemon, chaat masala. Like that, these are the dietary modifications in which we can induce erythropoiesis. We can help the bone marrow stimulation to start the erythropoiesis, because there is a continuous destruction is going on due to Sahaj Pandu, because there is a directly beta fetal content, fetal HB is more there, and that's why the continuous there is a need of blood transfusion. Another condition is aplastic anemia, in which bone marrow does not produce sufficient blood cells and hence marked decrease in RBCs and WBC platelets. So signs and symptoms are anemia, short breath, petechial hemorrhage, increased risk of infection. The main petechial hemorrhage is the main typical feature. Thereby we can diagnose this condition easily. Another condition is sickle cell anemia. There are two categories, that is A.S. pattern and A.S.S. pattern. A.S. pattern is a little bit less troublesome, but A.S.S. pattern is very much troublesome, in which the lifelong care is required. So mainly glutamic acid is substituted by valine, and sickle cell trait. These complaints are anemia, ischemia, pain, necrosis or organ damage, or jaundice, arthritis, or hepatosplenomegaly. If the SS pattern is there, patient is going to suffer with so many variety of complaints and requires lifelong care. You can appreciate here the size of 2 mu only, microgram only, and here the 8, the to normal RBC size is the diameter is 8 mu, but here only 2 micron is there. So you can see the size of the RBCs like dumbbell shaped or spindle shaped. So whenever such picture is we can show in PS, that is directly leads to the diagnosis. Also there is a another test, that is hemoglobin electropathy. So by this test we can directly check whether baby or patient is suffering with AS or A.S.S. pattern. In this, due to that sickling, there is a collection of this destruction takes place, and collection of this spindle RBCs, sickled RBCs, and due to that there is a ischemic condition, and that's why arthritic like condition are generally occurred, and patient is mainly complaining of pain in both legs, and very much clumsiness, and very much tiredness, because there is a obstruction in the vessels due to that collection of sickled RBCs, and that's why the proper circulation hampers and supply hampers. The main treatment is 3-weekly penicillin prophylaxis, folate supplementation, and immunization with pneumococcal hepatitis vaccination, which is very much important to because these patients are very much prone to pneumonia as well as hepatitis. That's why it's mandatory to give and prevent pneumonia and hepatitis with the help of immunization. and analgesic therapy, because there is a continuous complaint of pain. Here we are completing the part of anemia. So to summarize this anemia, we can firstly check reticulocyte count. If the reticulocyte count is increased, that is elevated, then we have to look for the causes. And if it is increased, then destruction or bleeding we have to rule out. Then if normal or decreased, then look for causes of marrow failure. And in marrow failure tailored by MCV or RDW, especially due to these components of CBC, we can easily see that what is the cause of anemia. So coming to the Pandu, Nirukti is Padik Dhatu, that is, which means Gati Parinama, that like transformation. This is suggestive of Dhatu Parinam from Aras. And by definition, these are the so many terminologies and nirukti mentioned in our science, and that is pita bhaga dhayikara and ketaki duli sannibaha, and pandu hinarupa vegi ghatakanti, and means kanti or varna, or the main nomenclature based on varna, especially Kamla and Kamla, Halimak, and Pandu. These three diseases are specially nomenclatured with the help of Varna. So Nidan, if we're talking about Nidan, the main Nidanas are divided into Aharaj, Viharaj, and Nidanarthak Roga. If we talk about Aharaj Nidan, the Rasapradhan are Amla, Lavana, Katu, Kashay, Kshar, means Pitta Vardhak in nature, Amla, Lavan, Kshar, and Katu, Kashay. Then Guna, if we talk about Guna Pradhan, then Ruksha, Ushna, Tikshna, and Vishamashan like conditions is there. There is a history of taking this kind of food. Then there's a Vidagdhanna, like Chinese food, like very much spicy food, or Mash, Nishpav, Pinak, or Pishita, or Til Tel, or Mrudbhakshan, that is Paika. Then Amish or Viruddhashan. And if we talk about Viharaj Nidan, then Diva Swapna, that is day sleep, Ati Vyayam, overexertion, Vegadharan, then Pratikarma, and Adiksharan. These are the certain causes which call it as a Viharaj Nidan. In Mansik Nidanas, Kam, Krodh, Chinta, Bhay, Shok, these are the certain conditions, the mental conditions in which especially Krodh and Chinta. These are the two which liberates heat, and due to that heat, there is a Pitta Visheshan, which leads to the skin and discoloration of skin, that is Panduta. Nidanarthak Roga, there are variety of list. There is a big list of Nidanarthak Roga in which there is a tendency to develop the Pandu along with that particular primary diseases. That is Jirna Jwara, Krimi, Raktarbuda, Grahani, Pitta Kasa, Rakta Pravartana, and Yakrut Pliha Vyadhi. These are so, the list is very big. Coming to the Samprapti of Pandu Roga. First of all, Nidan Sevan, history of Nidan Sevan is there. Then Pitta Sanchay in Amashay along with Vata and Kapha. Because whatever we eat, it goes to Amashay first. And there is already SCL is there, that is Pitta is there, Pitta Sanchay Avastha is there, because the Vidahi and Vidagda food is there, Vishamashan kind of food is there. That's why there is a Pitta Sanchay. And the normal Pitta gets turned into Vidagda Pitta. That is Pitta, the Dravaguna of Pitta gets increased. And that's why there is a maybe regurgitation or like Amla Pitta like complaints may be there associated with Pandu. Then Rudrava or Pitta Prasar, and which is mainly to Yakrut Pliya also, because Yakrut Pliya is the main Rootastan, Raktava Srotas Moolastan, and this Moolastan gets vitiated by Pitta Prasar and due to Van Vayu, and then Stan Sansra in between Twaka and Mans vitiated Kapha Vata Rakta along with, and this Vyaktavastha of Pandu, that is Rupavastha of Pandu occurs. If we talk about Samprapti Ghatak, main dosh is Pitta, and Pitta Pradhana Tridosh we can consider in this anemia, because this is the Apatarpanaj Vyadhi, and here mainly the source of this disease, Vyadutpatti due to Aharaj. Ahar is the main source, main Nidan. So, other dushas which are helpful in Samprapti are Rasa, Rakta, Mansa, Medha, Asti, Majja, Shukra, Oj. All Sapta Dhatus are involved in such condition because mainly each every cell, tissue, organ, all are required for supplement of blood, and that's why they every cell tissue can work. And if the mainly ischemic condition is there, means the supply is very much less, then we can consider it as each and every dhatu is get involved in the Samprapti Ghataka. So, Sroto Dushti Prakar, we can say that Sangha, because especially bone marrow affection or erythropoiesis is disturbed, or absorption is disturbed, or sickling like condition where channels are avrodhitva. That's why you can easily guess that the Sroto Dushti is Sangha variety. Then Udbhav Sthan is Amashay, because mainly Aharaj Nidan is the main focus of Nidan. And Sanchay Sthan is Sarvanga Sharir through Dashadhamni. And Vyakta Sthan is Tvakar, Rogamarga, Bhaya. And Agni is Jatragni and Dhatvagni both. And Arm is same, Arm is related to spreaded by all over the body. If we talk about Pandu Bhed, as per Charak, the total Bhed are total types are 5: Vataj, Pittaj, Kafaj, Sannipataj, and Vruddhakshanjanya. Then as per Shushruta Samhita, these are 4 only: Vataj, Pittaj, Kafaj, and Sannipataj. And as per Vagbhat, these are again 5, as same as described in Charak Samhita. In Vednadhyaya also there is a clear-cut depiction of especially Pandu and again Kamla by Acharya Kashyap, and he has beautifully described the detailed and chronic Pandu lakshanas like Nabhi Asmanta Shot, Shweta Akshi Naka Vakrata, Agni Sad, and Shwetu Akshikut Bhru. Why acharyas have directly go to the last stage of that anemia, that is severe anemia. Whenever there is a severe anemia is there is a anemia induced inflammation condition is there, and this inflammation directly due to the cause by edema. Inflammation and edema are very much similar entity, and in which there is a retention of salt and water, reduced glomerular filtration rate because blood is less in quantity, and that's why blood pressure is reduced, and there is a reduced GFR. Then neurohormonal activation is there, and also reduced inhibition of basal endothelium derived factors, which leads to generalized vasodilatation. So due to that generalized vasodilatation, there is, we can see that there is a Shuna Akshikuta Bhru, means there is a swelling all over the peripheral orbit of the eye, and Nabhi Asmanta Shot. Because this is a condition where there is a chronic anemia from so many months or year, and it leads to the hepatosplenomegaly. Here, Nabhi Asmanta Shot is directly related to the hepatosplenomegaly. And by darshan pariksha only we can see that there is a pot belly like symptom, and if we palpate the abdomen, we can get the shotha, that is due to hepatosplenomegaly there is a Nabhi Asmanta Shot is there. And Shwetakshi means pallor color is there, Akshi means eyes. We can directly pale varna panduta we can visibly check in the conjunctiva. And nakavakrata, nails are very much brittle in nature and easily get spoon shaped, that is colonychia is there. And vakrata we have already discussed in anemia part. And also the same clear cut depiction is mentioned by Acharya Kashyap and Charak also. So the features are Agnisad, Shwayathu, and Akshikut Bhru, which already we have discussed due to the generalized vasodilatation and generalized inflammation. Another condition is Mridabhakshanjanya Pandu. Especially whenever there is a consumption of Kashai, Katu, and Madhura Rasa Pradhan, Mrittika, that is mud, or we can say that sand, or माती ज्याला आपण मराठीत म्हणतो की whenever we children eat, then which leads to vata pitta and kapha vitiation or prakop, and respectively which in turn leads to the avrodh of channels, and which leads to the ischemic condition and supply is getting deprived, and that's why it leads to mridbhakshan janya pandu. The non-edible substances, like we have already discussed, like sand, paint, or mud like substances, doesn't get digested by the metabolic fire, and that's why the agni is totally not able to digest, and it leads to obstruction of the channels, hampers the circulation in the body, and deprive the required nutrition. Whenever there is a deprived nutrition, it directly ischemic like condition is there, and further causes dryness and rukshata or damage of the system. In such condition, the main focus is to clear the clear the avrodh, and whatever is accumulated in the channels, we have to remove it away. Then only the channels get freely absorb the total nutrients, and they can supply the properly supply the nutrition, or supply the circulation gets proper. That's why we, for Srotoshodhan purposes, we can give Mrudu Virechan here is the choice of procedure, and Satvavaja is the choice of Adravya Chikitsa, because here we have to check out the habit. We have to that habit of eating mud like or paika like condition. So that habit must be stopped. And for that habit removal, we can take help of Adravya Chikitsa, that is Satvavaja. Here, Satvavajay mainly leads to counseling, proper counseling of child as well as parents to take care of their ward. So here, mainly these, especially Shodhan and as well as Adravya Chikitsa, Satvavajay, these are the main tools. And later we need to give the supplement of Bruhan, Rasayan to make the things proper, and because there is a continuous state of deficiency state, and we have to give the later after Shodhan only we can give Rasayan and Bruhan. What are the complications of such conditions, especially Mritika Bhakshan Janya Pandu or chronic Pandu or such recurrent Pandu? Then Shuna Akshikud brew, already we have discussed, Nabhi Asmant Shodh, Angasad, Tej, Ojo, Balnash, Shwas Ka, Satisar, and Klama, Jwara, Hruday Pidana, Shofa, Tandra, Brahma, Pipasa, and Murcha. These are certain conditions in which there is a very severe anemia is there, which leads to organ damage and shock condition, and later death also. So the main treatment principles are Agni Dipan. Dipan means what? Which specifically augment the Agni, but not digest the arm. And what is the difference between Pachan? Pachan means which digests the arm, but not Sanduksha. Agni Sandukshan is not particularly focused, but focus is arm Pachan. And Vatanuloman to just Mrudu by giving certain drugs which facilitates the proper direction of Vat, that is Apana Vat Anuloman to that is to channelize to as a Srutoshodhan, as a Sanchita, whatever toxic condition is there, we have to eliminate it by Vatanuloman. So later on only we can give Snehana, that is with the Abhyantar Ghritapan, because Pitta is the most useful Pitta Shamak Dravya is Ghrita. That's why Charkacharya has, especially Chikitsa, he has mentioned so many Ghritakalpas. That's why here there is a utmost important role of Ghrutapana. Then Vaman Virechan, as per the need. If Kapach Pandu is there, we can give Mridu Vaman. If mainly Pitta dominant condition is there, because Pandu is mainly Pitta Pradhan, so Mridu Virechan is utmost required. But if particularly Kapach Pandu is there, we can give Vaman also. But Mridu in nature, because we are talking about childhood anemia. So Shamanoshadis are very much according to the need, according to the dosha avastha, and as per the involvement of doshas, we have to give Shamanoshadis. And also dietary modification is mandatory here, and Patha Kalpana is mainly important tool to help in the chikitsa. Shamanaushadhi, you can see that there are so many variety of Loha Kalpas, particularly Dhatri Loha, Namas Loha, and so many Loha Kalpas are there. Saptamrut Loha, then Dhatra Rishta, Dhatra Leha, then Godo Rishta, Lohaso, Punarnavaso, Dadimao Leha. There are so many different types of Ghruta and Kwathas, particularly Falatrikadi Kwath and Bunimbadi Kwath. These are the certain Kwath preparations. Then Rasoshadis, particularly all Bhasma varieties, Navas Loha, Nisha Loha, Dhatri Loha, Vidangadi Loha, Tappadi Loha, Purnarava Mandur, Lagumarini Vasanta. These are the certain yogas which helps in the to deal with the absorption factor, then augmentation of intrinsic factor, then Srotoshodhan, whenever we talk about Sahaj Pandu, then these especially Lohakalpa, whenever, because in certain conditions like thalassemia, there is already iron overload. Body doesn't require Lohakalpa, but in other, as per the need, we are talking about Lohakalpas. Whenever there is a need, we have to give Lohakalpa. In each and every anemia, we don't have need to give Lohakalpa. Patha, if we talk about Patha particularly, Puran Shali means Puran Shali means जुना भात ज्याला म्हणतो आपण की पुराण शाली यव गोधूम शाली and mudga and surana and all jungle mass and patol, lasun punarnava bimbi haridra. These are certain, especially navneet and gogruta and godugdha. These are the pitta shamak in nature, especially red fruits, all dadim or tomatoes or all red fruits are very much required because vitamin C, it is already proven, research proven that vitamin C is helpful in absorption. And again, there is a siddhant of samanena saman vriddhi. Means whenever we give red colored fruits, it going to increase the red blood rakta dhatu. That's why in this Patya Shreni, we must do dietary modifications to help in our chikitsa. Also, we have to stop the apatya taking, consumption of apatya dravya like shimbidhanya, mash, hingu, sarshapa, like ushna tikshna drug or mrudabhakshan, especially tikshna or labana, vidahi, vishtambi or guru or vidaha, especially vishamashan, and all such should be avoided. I'm going to discuss these two cases, particularly one case is having 8 years old male child with known case of sickle cell anemia with the complaint of pain in lower limbs, joints, and poor weight gain, lack of appetite, and generalized weakness, and the recurrent onset of respiratory tract infections, URTI. The treatment was planned with the principle of Dipan, Pachan, and Vatanuloman. And again, because it is a sickling in nature, there is a A.S.S pattern was there. That's why we have given Raktashodak Gand. And Raktavardhak, it is not at all much necessary, but some Raktavardhak dravyas are helpful with Raktashodak Gand and subjectively relieved with said complaints with Abhyanga, Mrudu Svedan on both legs and holistic approach. Only local, basically we talk about the Pandu treatment. As Pandu is a Pitta Pradhan, that's why Svedan is actually contraindicated. But in this case, there is an accumulation of sickled RBCs. That's why to eliminate it, to remove the blocked channels and to clear the channels, we need Mrudu Svedan to facilitate the elimination. That's why for local parts only we have given Mrudu Svedan. And also assurance like holistic approach and counseling. In another case, which is based on Mridvakshanjanya Pandu, a 4 years girl was habitual of pica eating, having complaints of no weight gain, dull in activities and academics, with pain in abdomen off and on. So history revealed the fact that she was having a habit which is revealed by history and treated with the same principle Dipan Pachan Vatanuloman and Mrudu Virechan with the help of supplement of multivitamins and minerals and also counseling and assurance. So, at last summary and take home message is every anemia doesn't need blood transfusion. So, whenever there is a HB less than 5 gram percentage, then only we have to think of blood transfusion. Otherwise, not. There are so many variety of Shamanaushadis, especially having animal origin, herbal origin, herbo-mineral, metallic. So, we have so many rich heritage to have so many variety of Shamanaushadi, and also we can use judicially with the help of Bal Panchakarma procedures like Snehan, not Swedan particularly, but Mrudu Virechan is important here. And also Satvavajaya holistic approach and Nidan Parivarjan and Pathyapasta do wonders, and especially Rasayana to prevent such condition, because as Pandu is Apatarpanaj Vyadhi, so we need to boost the lost means deficiency state of nutrition, and that's why we have Rasayana to build the weight gain and to exclude the deficiency state. Thank you all. I'll be grateful. I'll be welcome if there are any queries and discussion. Thank you all for patient listening.
Thank you so much, Dr. Rehman, for informative lecture and explain this important topic in simplified manner, so everyone can understand and easily experience and applied approach will help us to understand and treat the patient. Once again, thank you so much, ma'am. I invite Dr. Santosh Pathak sir, Assistant Professor, Department of Sharya Tantra of our college for delivering the open.
Namaskar. The roots of all goodness lies in the soil of appreciation for goodness, and the essence of all beautiful things lies in gratitude. So myself, Dr. Santosh Pathak, Assistant Professor from Department of Ayurved. It is my great pleasure to propose a vote of thanks on this occasion of national webinar on childhood anemia and Ayurvedic approach, organized by Department of Kaumarbhritya, Ayurved Mahavidyalaya, Nashik, on the occasion of Azadi Ka Amrit Mahotsav and Poshan Pakha. And on behalf of Ayurved Seva Sangha Ayurved Mahavidyalaya and the entire organizing team of this national webinar, extend a very hearty vote of thanks to our distinguished speaker, Dr. Renu Rathi, MD Kaumarbhritya from Mahatma Gandhi Ayurvedic College, Varda, for her excellent presentation and making this seminar interesting and meaningful. She has emphasized on Nidan Parivarjan, correction of deficiencies, Rasayana Dravyas, and Shodhan and Shama Aushadhi for anemia. We are thankful for her knowledgeable speech on childhood anemia, which will be very helpful and beneficial to all our delegates and participants. Thank you very much, madam. I would like to take this opportunity to place on record our hearty thanks to our dignitaries of our institute, President Dr. Ambadas Kulkarni sir, Vice President Dr. Ashutosh Yadav sir, and Secretary Dr. Abhay Kulkarni sir, for their perfect logistic support and encouragement for organizing this seminar. I am also extend my sincere thanks to our Principal Dr. Sonabekar sir, Vice Principal Dr. Joshi sir, for their strong support and guidance for organizing this seminar. My heartfelt thanks to all the delegates for their participation and presence in this webinar. Because of them, this webinar has become fruitful. And lastly, we are very thankful to all the faculty members of our college, professors, UG students and PG students and our teaching and non-teaching staff for their contribution in all our efforts for making this seminar a successful. We thank you, all of you, for being with us in this afternoon. So it was a great pleasure. Thank you. Thank you very much.
Thank you. Thank you, organizers.
Thank you.